Hello, welcome to BEH 215, Behavioral Health Case Management. Today we're going to discuss health and human services management. So why do we need managers? Without management, organizations as we know them would not exist. Management is what makes an organization different from just somewhere that people rattle around in random purposeless activity. Management provides direction, prioritization, and feedback. For those of us who have worked in a management role, part of the job is getting into the trench with the employees and making sure everything is done correctly, but it's also making sure that the strategic goals of the institution are being met. And so being a manager can be a very challenging job because oftentimes the people you supervise do not see that you are, in fact, providing direction, prioritization, and feedback. Even if behavioral health workers choose not to take a management job, they need to understand management in order to interact effectively with colleagues in their management roles. Plus, it is inevitable that all behavioral health workers will perform a variety of management tasks with their clients. So, whether you are managing your clients or managing your staff, there's a lot of the same overlap of skill sets. A lot of people end up backing into management, and what that means is we anticipate a career offering direct services to clients. However, a lot of times we realize that if we move into management, we have a lot more opportunity to effectively and efficiently offer better services, be more organized, provide better opportunities for others. So although many of us may plan to spend our day offering individual, family, or group services to clients, we soon find themselves promoted into a supervisory position or simply have certain management tasks delegated to them that normally may fall on others. There's an old saying that cream always rises to the top, and that is a very true statement in a lot of ways. If you have great leadership skills, you inevitably will be approached for a management position, even if you don't want it. Some people are only convinced how important good management is when they see poor management and its impact on our ability to do our job effectively. A good manager makes it look effortless. A bad manager tortures everyone. So just a few little rhetorical explanations, because we see words that sort of mean the same thing, but within the context of management or business, they have very different meanings. So one of the big combos, management versus administration, those are often used interchangeably. However, the critical difference between these two words is that administration entails primarily policy making, while management entails primarily implementation of that policy. So in a nutshell, management is about the operating of the business. It's managing the operations, whereas administration is about strategizing for the business, being able to plan way in advance, whether it's 3, 6 months, a year, 5 years. And as a consequence to that, you'll often see your top line managers, the director, focus on administrative tasks, and your supervisors focus more on the management or operations of the business. Another rhetorical phrase that you're going to hear thrown around a lot are case management versus care management. Management means specific activities performed by employees at all administrative levels within human service organizations that are designed to facilitate the accomplishment of organizational goals. Now, when we look at case management, We use this as a verb to suggest a wide range of activities that consist of virtually anything related to directly servicing clients. On the other hand, care management means that a manager takes an active role in influencing or shaping various aspects of the work environment, specifically operations, finance, employees, and clients. And these activities are designed to increase the likelihood of organizational goals being achieved and the delivery of effective services to the clients. So, what do managers seek to accomplish primarily? The efficient delivery of effective services to clients, especially in the behavioral health care field. Managers are expected to make the organization function more efficiently, usually by finding ways to reduce costs, thereby increasing the likelihood that contribution or profit will be greater. Now, those of us who are in a mindset of helping people, we're like, well, it's not about making money. No, it's not. But the better managed an organization is, the greater the profit, or in the nonprofit world it's called surplus contribution. The more of that we have means we have more services we can offer to our clients. The biggest issue in any kind of behavioral health environment is the cost of services and programs. And a lot of people don't have insurance or can't afford the programs or the copays. So part of the surplus is often used to help with free or reduced services to clients who are unable to pay for them, like homeless shelters, food banks, and other services for children that will often include free childcare for when the parents are trying to get jobs and things like that. The key here is it's not about making a ton of money for the company. It's about making money so that we can offer more opportunities to help people with their challenges in life. And that is the goal that management in behavioral health seeks. Some of the tasks of management include in identifying problems and opportunities for addressing them, representing the organization to staff members and in the community. The reality is that once you belong to any organization, you represent them, and especially if you are a manager, so you have to be very mindful of that. Keeping others on track and resolving interpersonal conflicts, oftentimes either between staff members or if there's a problem between a client and a staff member or between clients. Social work and behavioral health care work is very stressful, and people recognize that. But the better your manager, the less stress you feel because you know you have someone who's got your back. So being a good manager is going to help your employees do a better job. Management is both a science and an art. As in other areas of practice, managers should be committed to making decisions based, at least in part, on the knowledge that is collected through rigorous research methods, which is essential to evidence-based practice. Another sizable body of relevant knowledge has been accumulated in the business field. This material is available in a category loosely identified as management theory. Management theory comes from a variety of fields, including manufacturing, retail, healthcare, and banking. This knowledge is borrowed from other fields and applied to human service organizations. So, yes, management's going to differ very much from a banking environment to a healthcare environment to a social services environment to Disney World. But making sure the client's needs are met is across the board the most valuable piece of that management piece. So here's some examples of research related to behavioral health management theory. So here's just some articles I pulled up and put together a little bibliography. Blue Cross spins off behavioral health affiliate. Managed care entity and provider partner on meth treatment approach. new practice model for Latinos in need of social work services. Oftentimes you will see articles on how to work with specific cultures or communities, because a lot of the work that's been done, especially in the United States, was done on Caucasian or white people. And the vast majority of people in the United States have been white historically, but it's been changing. We now have 20% of the population being Latino, 14% being African American. Asians account for 5%, so we are seeing a need for a more diverse understanding of culture. The availability of behavioral health services for youth in the juvenile justice system. This is a very big issue. Juveniles who commit crimes usually do so because they've been traumatized as youths. As children they were abused or sexually molested, and oftentimes they've never gotten any kind of behavioral health care. And then finally, when high pressure, systems constraints, and social justice missions collide, a socio-structural analysis of emergency department social work services. So again, what you see here are a variety of articles related to this field about how to improve or how to change or different strategies to work with. In addition to the evidence-based scientific study of management, there are best practices that are usually developed through experience and perspective. The art factor enters in when we actually apply the best available knowledge to a specific situation or problem. So in terms of any kind of experience that we have in our lives, think about driving a car. The first time you drive a car, you're very nervous. You've got all these mirrors to pay attention to. There's cars whipping past you. You're not sure what the speed limit is. You're not sure where all these knobs are. And you are hyper anxiety ridden and you just feel overwhelmed. Well, give it 5 years and you can drive and not even think about driving. It's something that you can do unconsciously. Not unconscious, but unconsciously, meaning you can think about the fight you had with your spouse that morning as you drive to work without really focusing too much on the driving itself. The point is that the more experience you have, the better your perspective or the better your understanding of a scenario is. So, those people who have worked in the field for a really long time have seen a lot of stuff and have a certain level of perspective that can be very, very helpful. One of the best things you can do when you get a job in the field is get a mentor. Somebody who's worked in the field for years and can offer advice and tell you what to look out for. Because as a new employee, there are always going to be issues that you're not sure how to manage. So, highly recommend mentoring. This knowledge related to management can be thought of as existing in 3 somewhat overlapping categories: descriptive, predictive, and prescriptive. The preponderance of the available knowledge is descriptive. Descriptive knowledge begins to accumulate from a variety of methods of realistic and practical experience and observation. So, hey, what did you do when you found out that your client was using and they had been told they couldn't use illegal substances? That's the kind of thing, is what happened when you had this experience. So predictive knowledge is knowledge that provides an educated guess regarding what will occur in the future in a given situation. It is based on the assumption that what occurred in the past is generally a pretty good indicator of what will occur in the future. In plain English, it's called a best guess. Frequently, in many behavioral health practices, we rely on the past in making decisions that involve predicting the future. For example, if you have a client who stopped taking his medications when he is not in a facility where meds are tracked, then you can predict that if he is released from a medical facility without supervision, he will stop taking his meds. Prescriptive knowledge is knowledge about how to intervene, how to act so that what is predicted to occur can be changed. To use the previous example, this client who won't stay on his medications could be placed in a group home or other facility where a visiting nurse or a group home manager ensures that the clients take their meds. So let's talk about managers and management. Management consists of important activities that are performed by all persons within a work setting. Those people who carry titles such as director or administrator usually spend a larger percentage of their time performing management functions than others within the organization, such as those with titles such as case manager, therapist, or group worker. Management decision-making is increasingly becoming the work of teams, often made up of people from different sectors and levels of the organization rather than that of individuals. So in the following organizational chart, you have the director and his or her secretary, and then there are 7 sections that report to the director. In this context, you will often have a department head for each of these sections, and they will meet with the director to work on decisions that will ultimately be the director's choice, but each section has input into the decision making. So let's talk about some of the skills you need to be a good manager. Technical skills, super important. For example, you need to know how to construct a budget, write a grant proposal, or design and implement a fair program evaluation. One of the big issues in today's world is assessment, and we have to be able to identify what programs are effective and what programs are not effective. And the more effective a program is, we can then budget more money towards those effective programs. Managers also need good conceptual skills. They have to be able to do more than just observe what is around them. They need to be able to accurately identify the origins, interpret what something means, and identify the best way to handle a situation. So, when we as managers are examining what is going on, with any kind of, whether it's an interpersonal situation, a scheduling problem, a finance problem with budgeting, we have to be able to identify why it's a problem, not just the solution to how to fit, because we don't want it to occur again in the future. Interpersonal skills are also very important to good management. While critical to management success at any level, too much reliance on charm and charisma can quickly antagonize others who start to feel manipulated, caseworked, or demeaned in some other way. So you can't just get by on your fabulous personality. Strong interpersonal skills means that a person works well in a team and is able to communicate effectively with colleagues, customers, and clients. Additionally, people with strong interpersonal skills tend to be optimistic, calm, and confident. They're not arrogant, they're confident. Individuals with strong interpersonal skills inspire trust, and that is one of the keys to being an effective behavioral health care worker. So here's a little picture of some of the aspects of interpersonal skills. Starting at kind of an 11 o'clock on the clock face, effectively conveying information, accurately interpreting people's emotions, calmly arriving at resolutions to conflicts, avoiding gossip, being polite, and being sensitive to people's feelings. And just to kind of back up to that avoiding gossip one thing, we love as humans gossip. It's so much fun. But here's the thing, at work, if you are a manager, you have to rise above that kind of stuff. You have to treat everyone with the same regard. And if you have heard gossip about somebody, it could very well influence your decision making. So you want to avoid gossip, but if information is communicated to you about a problem or a potential problem that transcends gossip, then you really need to manage that problem and not see it as gossip. An example would be if there was rumors going around that a care worker was inappropriately having a relationship with one of their clients. So another aspect is ethical management practices. These activities that promote ethical client services, social justice, dignity, respect, integrity, and the value of an individual. So in the role of a manager, the behavioral health care worker must consider the rights and needs of the individual client or client system, the rights and needs of all clients and client systems collectively, and the rights and needs of those presently served by the organization as well as those who might be served in the future. There are certain conflicts in which any decision that the manager takes may result in criticism and charges of unethical behavior. The reality of being a manager is that you are oftentimes the bad guy, even when you are making the best possible decisions. Someone is always going to be mad at you. That is just the way it is. And to be an effective manager, you have to just not let it bother you. If you know you are right, if you have the code of ethics, if you have the laws, if you have the regulations, if you have policy on your side to back you up, you have to let go of needing people to think you're awesome, because they are going to think you're awesome if you are fair and just with everyone. So let's talk about ethical management practices. The authors of the NASW Code of Ethics recognize that ethical conflicts are inevitable in all areas of social practice. However, the Code of Ethics is just one source that managers need to consider when seeking the ethical course of action. The NASW Code states, in addition to this code, there are many other sources of information about ethical thinking that may be useful, including ethical theory and principles, social work theory and research, laws, regulation, agency policies, and other relevant codes of ethics. So, for example, a behavioral health care worker at a mental health center has a caseload that requires them to travel to visit their clients. A coworker discovers that the behavioral health care worker has been inflating the amount of their reimbursable travel expenses. What should the coworker do? Is this an ethical issue or a legal issue? So, what you as a coworker has to do is going to be different than what the manager has to do. And when we as managers are faced with an employee who may or may not have been there for 10, 15 years and they've been padding their expense accounts, how do you deal with that? How do you manage that employee? And there are no easy answers. You could say it's a legal issue where they're violating the policies of the company. You could say it's an ethical issue in terms of they're violating the code of conduct. So again, when you're looking at this kind of a construct, there's a lot of issues that go into what a manager needs to think about. So what makes a manager a good manager? Good managers understand that a higher position on an organizational chart does not mean superior in every respect or all-knowing, and do not act as if that were the case. Management entails working with and through individuals and groups to accomplish organizational goals. And from my own personal experience, what I found is if I can demonstrate that I can do the job of the people who work for me just as well as they can, then I have earned the right to be their manager. So it's important as a manager to not just be a good manager, but to also be a good employee in terms of as you work your way up that so-called ladder of success. In a well-managed organization, managers have succeeded in organizing and regulating the activities of others. They have shaped the work environment to focus staff attention on achieving the goals and mission of the organization. Effective management also requires the same core competencies that are required for effective practice in any behavioral health role. And just to review those, here are the 10 competencies that are essential for effective behavioral health practice. 1. Identify as a professional and conduct oneself accordingly. 2. Apply ethical principles to guide your decision making. 3. Apply critical thinking to inform and communicate professional judgments. 4. Engage diversity and difference in practice. 5. Advance human rights and economic justice. 6. Engage in research-informed practice and practice-informed research. Apply knowledge of human behavior and the social environment. That was 7. 8. Engage in policy practice to advance social and economic well-being and to deliver effective social work services. 9. Respond to context that shape practice. And 10. Engage, assess, intervene, and evaluate with families, individuals, groups, organizations, and communities. So, when we look at any kind of management job, you have to have your core responsibilities before you can even move up into that management field of efficient and effective shaping of the goals of the organization. So, that's it for today. If you have any questions, please feel free to email me or text me or leave me a comment in the YouTube comments. So, thank you very much. Have a great day.